Hello, I'm Parth Rali. I'm a pulmonologist. I work at Temple University Hospital in Philadelphia. I've been doing a pulmonary practice for last 7 years. I'm also an ICU physician. I perform a lot of bronchoscopies and a lot of ICU-related procedures day in, day out. Cetacaine is simple, right? I'm an ICU physician. I like to keep things simple, right? As if it's simple, then I enjoy that. And Cetacaine does that because it's one stop to achieve all the three components that we need to achieve to get the upper airway well anesthetized for the optimized procedure, because it can guarantee you that it is rapid onset of action. It has a very predictable duration of action because of three components of the drug, and it takes away the variability out of it because it's a simple spray and everybody knows how to use a simple spray. Cetacaine has 30 seconds of action, and I think it's extremely important because, as I said, that sometimes when we perform these procedures, those procedures can be performed emergently. Sometimes we have 10 bronchoscopies in a day, and you don't want to get behind on your case one. And I think having a rapid and reliable source of onset of action is extremely important when you are performing a procedure which may have a lot of downstream consequences if not performed appropriately. Cetacaine has a lot of advantages over lidocaine. I think the way I would think about in the portion of the patient's perspective, patients will love this because it has a long 60 minutes of effect. It has very rapid onset of action. It is very easy to apply Cetacaine. It's less anxiety provoking for the patient perspective. When you talk about provider perspective, it's important that the onset of action is very rapid, so there is no lag time leading to a procedure. So you can be a procedure ready within a minute versus 20-30 minutes of procedure ready when you use lidocaine. The biggest advantage is that I like the triple action mechanism of the drug. The Cetacaine has three components of the drug that we know. One is a very rapid short acting, one is long acting, and there is a third component which kind of bridges between the two drug components. Lidocaine doesn't have that. So literally you have a simplest formulation with a nasal application with a long lasting effect versus lidocaine nebulizer, which has one drug, needs a little bit of extra help. Sometimes a lot of people don't know how to set up the nebs also. So if you look at it, it's no brainer. It's a win-win with Cetacaine.